Hi, hello, welcome back to my channel. Today topic is WHO Part 2. World Health Organization promotes and the road safety means reduce traffic related injuries. Also worked global initiative surgery including emergency and essential surgical care, trauma care and the safe surgery. While WHO surgical safety checklist current use worldwide of the effort improve the patient safety. Emergency work. World Health Organization primary objective natural man-made emergency coordinate with the member states and stakeholder of reduce avoidable loss or life and burden disease disability. On 5 May 2014, WHO announced that spread polio was World Health Emergency outbreak and disease Asia, Africa and Middle East were considered. Liberia and Sierra Leone situation West Africa was considered very serious. Reform effort following Ebola outbreak. Following 2014 Ebola outbreak, West Africa organization was heavily criticized bureaucracy, insufficient of financing, regional structure and staffing profile. Internal WHO referred the Ebola is the response pointed underfunding the under lack of core capacity health system. Developing countries' primary weakness of the existing system. Annual World Health Assembly in 2015, Director General of Marcus Chan announced $100 million contingency of fund rapid response for future emergency, which had received $26.9 million April 2016. 2017 disbursement of WHO has budget additional $494 million as the health emergency program in 2016 to 17, which had received $140 million by April 2016. Program was arrived rebuilding WHO capacity. Direct action, which is criticized, said had been lost budget cuts of previous decade and had left organization advisory department member of state and on the board of activities comparison $billion have been spent parent development countries on 2013 to 16 Ebola endemic and 2015 to 16 Zika epidemic response to COVID-19 pandemic. WHO created incident management support team on 1 January 2022, one day after Chinese health authority notified organization cluster pneumonia cases unknown under the cluster as the ideology. On 5 January, WHO notified all member state outbreak. Subsequent day, prevent guidance all countries to have respond. Confirmed first infection outside China on 14 January 2020. WHO announced primarily investigation of the conducted by a Chinese authority had found on no human clear evidence human to human transmission of novel coronavirus. 2019 to NCOV identified Wuhan the same day. Organization warned limited human to human transmission confirmed human to human transmission. 1 week later, January, WHO declared public health emergency international concern. PHEIC considered call to action and last resort measure the international committee and pandemic 11 March. While organizing global response to the COVID-19 pandemic and overseeing more than 35 emergency operation cholera, measles and other epidemic internationally, WHO has been criticized praising China public health response crisis while seeking maintain diplomatic and balancing between interstate and China. David L. Heyman, professor of the infection disease epidemiology, London and School of Hygiene, Tropical Medicine and China has been very transparent and open sharing data and are open to of all files in WHO present. WHO faced criticism from interstate Trump administration while guiding world how to tackle deadly COVID-19 pandemic. 14 April 2020, interstate President Donald Trump said would be interstate funding WHO while reviewing the role severely mismanaging covering upon the spread of the coronavirus. World leader and health expert largely condemned President Trump announced that which came the amid criticism he's been responsible for outbreak interstate called announcement of recreatable and defendable of action alerting would be World to emergency in COVID-19. 8 May 2020, interstate blocked vote on UN Secretary Council resolution aimed promoting non-violent international cooperation during the pandemic and mentioning the WHO. July 2020, President Trump formally notified UN his intent to withdraw interstate from the WHO. Trump successor President Joe Biden cancelled the planned withdrawal under announcement of January 2021. The US would resume funding of organization. May 2023, WHO announced that COVID-19 was no longer worldwide health emergency. Health policy. WHO addresses government health policy with two aims. First, to address the underlying social economic determinants and health through the policies of program, enhance healthy inquiry, equity and integrated gender of responsive and human rights of based approaches, and secondly promote the gender responsive and human right based approaches, and secondly promote healthier environment, intensify primary prevention of influence and public policy in all sector, address root causes, environmental threat and health. Organization develop the promote use of evidence based tool, norms and standard to support member state inform health policy operations, option of overseas implementation of international health regulation, and publishes serious medical classification of these three are overreaching reference of classification, international statistical classification, disease of ICD, international classification functioning, disability of health, and ICF, the international classification health intervention, ICHI, other international policy framework produced. WHO included international code marketing breast milk substitutions and the convention of tobacco control adopted in 2003, globe code practice of the international recruitment health personnel and adopted 2010, as well as WHO model is essential medicine and patriotic counterpart of international convention on pandemic prevention and preparedness being actively considered. Terms and health service WHO look to improve governance and financing, staffing and management, availability of quality evidence, research guide policies also strive ensure improved access of quality and medical product technological. WHO working donor agency national government can improve the reporting about the US research evidence. Digital health topics WHO has 16 interagency collaboration with the International Telecommunication Union, UN specialized agency ICT including B Health and B Mobile initiated, and ITU WHO focus group for artificial intelligence for health. Policy in the package. WHO has developed several technical policy packages support countries to improve health, active physical activity, hearts, cardiovascular disease, empower, tobacco control, replace, trans fat, safer, alcohol, sake, salt reduction, governance and support. Remaining two WHO 13 identify policy area related to role WHO itself to provide leadership, strengthen governance and foster friendship of partnership of and collaboration with countries, interstate system and other stakeholder order fulfill the mandate. WHO advancing global health agenda and to develop sustain WHO flexible learning organization enabling to carry out its mandate more efficiently and effectively. Partnership of WHO along with World Bank Institute of Core Team Responsible Administration, International Health Partnership, IHP plus group partnership, government developed agencies, civil society and other commitment improving health citizens and developing countries partner work together, put international principle aid effectiveness and developing cooperation practice health sector. Organization release contribution from the renowned scientific and professional of from work of such as WHO committed biological sanitation, WHO expert committee leprosy and WHO study group and interprofessional education collaborative practice. WHO runs Alliance for Health Policy and system research targeted improving health policy system. WHO also aim to improve success health research in literature developing countries and such as through HINARI network. WHO collaboration with the Global Fund to fight AIDS, tuberculosis, malaria, UNITAID, Interstate President Emergency Plan, AIDS relief, spearheaded and fund the development HIV program. WHO created civil society reference group HIV which bring the together other network involved policy making and dissemination of guidelines. WHO sector international partner UNAIDC contribute to develop HIV response different area to world. WHO faced technical partnership through the technical advisory committee by HIV which they created developed WHO guidance and policies. 2014 WHO released Global Atlas Palliative Care and End of the Life joint publication with the Worldwide Hospice at the Alliance of Ability NGO working collaboratively with the WHO promote the CARE National and International Health Policy, Public Health Education Acts, practice empowering individual exert more control over make improvement of their health known as health education. Describe WHO shift away from the emphasis personal and behavior toward variety of society and environmental solution. Each year organization mark World Health Day and the other observation of focusing on specific health promoting topic. World Health Day falls on 7 April each year, timed March and match anniversary. WHO founding. The recent themes of have been vector-borne disease 2014, healthy aging 2012 and drug resistance 2011. Other official global public health and campaign mark WHO are World Tuberculosis Day, World Immunization Week, World Malaria Day, World Tobacco Day, World Blood Donor Day, World Hepatitis Day and World AIDS Day. As part of International World Health Organization support work toward Millennium Development of Goals, other 8 Millennium Development Goals 3 reducing child mortality, 2/3 of reduce maternal death of 3/4 and halt of begin reduce spread of HIV AIDS and related directly. WHO scope of other 5 interrelated affecting the world health. Data handling and publication. World Health Organization work provide needed health and well-being evidence through variety of data collection platform and including World Health Survey covering almost 4 lakhs respond from 70 countries. Study global aging adult health of covering over 5 lakh of person over 50 years old and 23 countries. Covering over 50,000 person over 50 years old, 23 country health intelligence portal CHIP has been also developed to provide access point to information about health service that are available in different countries and information gathered portal used by countries to set priority for future strategy or plan, implement, monitor and evaluate. WHO has published various tools of measuring monitoring capacity national health system, health workforce, global health observatory and CHO has been WHO main portal which provide access to data and analyze key health themes of monitoring health situation around the globe. WHO assessment instrument and mental health system, WHO aims, WHO quality life instrument, WHO QOL service availability readiness assessment as SCRA provide guidance of data collection, collaborative effort between WHO and other agencies such as through health matrix and network and aim to provide sufficient high quality information assist governmental decision making. WHO promotes the development of capacity member state used to reduce of the research address and their national needs including through evidence informed policy network EVIP net. Pan American Health Organization PAHO AMRO become the first region to develop and pass policy research and health approval of September 2009. On 10 December 2013, new WHO database known as MIND Bank went online. The database was launched Human Rights Day and it part of WHO Quality Right and Initiative which aim to end human right violation against people with mental health condition. New database present great deal information about mental health, substance and abuse, disability and human rights and different policies, strategies and land service standard being implemented different countries and also contain important international and document of information of database allows visitor to access health information of WHO member state and other partner user can reviews policy, law and strategy and research of best practice success and stories of field mental health. WHO regularly publishes World Health Report leading publication and including on expert assessment of specific global 2016 World Health Organization draft global health sector strategy and HIV in the draft World Health Organization outline of commitment to ending AIDS epidemics by 2030 in terms of target for year 2020. Make achievement toward this target draft list action of countries which WHO can take such as a commitment of to universal health coverage and medical accessibility, prevention of eradication disease and effort to educate and public some notable point made to draft including tailoring resource of mobilized region there where health system may be compromised due to natural disaster. Among point made, it seemed clear although prevalence of HIV transmission declining, there still need to resource health education and global effort to end the epidemic. Framework Convention Tobacco and Implementation Database, which one of the few mechanism help enforce complying with the FCTC. However, there have been report numerous discrepancies of between the national implementation report, which was bullied research of Hoffman and report was July 4, 2012, 361, 32.7%. 1104 countries' response were misreported. 33, 3.0% were clear errors. Indicated yes when the report indicated. 270 were missing, 24.5% despite countries having submitted response, and 58, 5.3% were our opinion misinterpreted. WHO staff. WHO has been moving toward acceptance and integration traditional medicine, traditional Chinese medicine, TCM 2022, new international statistical classification disease and related health problem. ICD-11 will attempt the enabled classification from traditional medicine, integrated classification from evidence-based medicine. Chinese authorities have pushed to change this. Other support to WHO traditional medicine have been criticized medical and the scientific community due to lack of evidence and risk endangering wildlife and hunted traditional remedies. WHO spokesperson said inclusion was not be endorsed and scientific validity any traditional medicine and practice efficiency of any traditional medicine intervention. International Agency Research Cancer. Further, the International of WHO Sub-Department International Agency Research and Cancer IARC conduct and coordination research and causes cancer. Also collect and publish surveillance data regarding occurrence of cancer worldwide. Monograph program identify hazards of evaluate environmental causes cancer, human structure and governance. World Health Organization member, International Development Group membership. January 2021, WHO has 194 members. State, all member state, interstate except 192 countries plus Cook Island and NIUE. Constitution of the World Health Organization, January 2021, also had 2 associate member at the WHO 2-year budget for 2022-23 paid 194 member and 2 associate member. Country have been granted observer status. Palestinian observer, National Liberation Movement, recognized League Arab State and International Resolution, sovereign military and order Malta and order attend the observer basis. The Holy See attend the observer of participation. Non-member state observer formal assembly resolution in 2021. Government Taiwan was also participated under the designation of Chinese Taipei observer from 2009 to 2016, but has not been invited again since. WHO member state appointment delegation to World Health Assembly, WHO supreme decision making body. All UN member state are eligible also WHO membership, and according to WHO website, other country may be admitted member when their application have been approved. Simple majority vote. World Health Assembly. World Health Assembly attended delegation from all member state and determination policy organization executive board composed and member technically qualified health and gives effect of decision and policies. World Health Assembly addition UN observer organization international commitment of Red Cross and International Federation Red Cross Red Crescent societies have been entered official relation with WHO and invited observer. World Health Assembly are selected alongside other NGO membership and partnership. Republic of China and the Republic of China ROC, which control mainland of China from 1912 to 1949 and currently govern Taiwan since 1945 following World War II. It was founding member of WHO since inception of had present and was changed People Republic of China established 1949 by Chinese Communist Party CCP. 1971 expelled ROC from both WHO and UN organs, which since time of per one China India and policy of both ROC PRC lay claims of sovereignty of each other territory. May 2009 Department of Health Republic of China was invented by WHO attend 62nd World Health Assembly as observer under name of Chinese Taipei was the ROC first participant at WHO meeting since 1971. Result improved cross-strait relations since MA and become the president of Republic China year before participant WHO entered the diplomatic pressure from PRC following the election 2016 brought independence-minded Democratic Progress Party back in power. The political pressure from BRC had led to ROC being barred from membership of the WHO other UN affiliated organization 2017 to 2020 who refused to allow Taiwan's delegation under WHO Annual Assembly. According to Taiwanese publication News Lens multiple occasions, Taiwanese journalists have been denied access to report assembly. May 2018, WHO denied access to Annual Assembly Taiwanese media report due to demands from the PRC. Later, May 172 member Interstate House representative wrote the Director General of World Health Organization argued Taiwan inclusion observer WHO interstate Japan, Germany and Australia. Taiwan supports of inclusion WHO. Pressure to allow ROC participate in WHO increased result COVID-19. Meeting concerning outbreak bring the rare unit from the Taiwan diverse political party, Taiwan main opposition party, KMT and National Party of the expressed their anger to being excluded, arguing disease respect neither politics or nor geography. China once again dismissed concern over Taiwanese inclusion with the foreign minister, claiming no one care more about the health and well-being of Taiwanese people. Central government PRC during outbreak, Canadian Prime Minister Justin Trudeau voiced support of Taiwan participant. WHO did Japanese Prime Minister as the January 2020 European Union WHO observer backed Taiwan participant WHO meeting related to coronavirus pandemics as well as general participation. 2020 interview. Assistant Director General of Bruce appeared to Dodge Goshina from RTHK reporter about Taiwan's response pandemic of the inclusion. WHO blaming internet connection issue. When the video chat was restarted, he was asked to another question about Taiwan. He represented indicating that had already discussed China and formally entered interview. This incident led to be a question of about PRC incident led to. Thank you.